Take. Hi, folks. I'm Bob Tauber, and
I'm Louise Jansen,
and we're your two instructors for online psychopathology class. And we're at the point of our course now where we're moving past assessing symptoms and the dimensions of symptoms, and moving in really to the idea of how to convert symptom patterns into diagnoses. And so we're starting with two of the most common diagnostic categories in the DSM that we're going to talk about now. And those two categories are, do you want to tell folks, people?
Mood disorders and anxiety disorders.
That's right, mood disorders and anxiety disorders. Anxiety disorders probably being the most frequent lifetime prevalence of any mental health challenges and mental problems. So where we are now, again, relative to that biopsychosocial model, is that it's still behind us here. We're not talking about etiology here, which means the biological, psychological, and social causes of the symptoms and the diagnosis, and we're not talking about treatment, biological, psychological, social treatment. We're talking about the DSM and the rule book from converting symptoms into diagnoses. So what we thought we'd do that would be most helpful, and it's something we do in our live classes, is that we're actually going to present you vignettes through role plays where one or the other of us are going to play a client who's experiencing a mental disorder in the area of anxiety disorders or mood disorders, and we're going to have you watch the video, and then as part of your work, come up with your best guess for what diagnosis you think would fit the best for what we're role playing. Now, we're not planning on doing these role plays to trick you. In fact, our whole goal is to help you build confidence in that, show you that you really can differentiate one diagnosis from the other, and also that to get you really comfortable with opening up the book and reading the diagnostic criteria. So what we're going to do is they're going to only be these vignettes from the mood disorders or anxiety disorders, and we're going to start with a diagnosis that's from one of the anxiety disorders. But again, we're not going to tell you which. In this case, Louise is going to play Linda. Yes? Linda is the client, and I'm just the person who's interviewing her to try to find out what her diagnosis might be. So,
and grab your books. This is not meant to be a test. This is getting used to using the DSM and having that book open to you so that you're familiar with the symptoms enough that you can narrow in on what the disorder might be, and then look specifically at the symptoms to actually say the name of the disorder and the number.
That's right. So there'll be more instructions, written instructions in your assignment, just exactly what you need to write down for this assignment. But just so you know, these tape segments will be separated. And so this is tape segment 1, and this is vignette example 1 from the anxiety disorders. So Louise is going to play. What's your name again?
I'm Linda.
Louise is Linda, and I'm Bob. And I'm just going to start off and ask her some questions, and then we'll see. We'll just go from there, and hopefully you'll be able to figure this out. So, Linda, thanks for coming in today. I understand that you came here on a referral from your medical doctor because your medical doctor was a little concerned about what was going on with you. Did your medical doctor tell you had any medical problems? What did they say?
No, he said that there was nothing wrong with me, but I don't really know if I believe that, because it's sure felt like I was having a heart attack or something, but he said I should come here, that there's nothing more he could do for me.
Okay, so what you were feeling like was like you're having a heart attack, but he checked you out for that and said there was nothing medically wrong with you. Oh, so tell me a little bit more about one of these, what feels like a heart attack. What goes on? What are you feeling?
I just got so, my heart was beating and just racing, and I was just shaking, and I just couldn't stop shaking, jittery, and he said there was nothing wrong, but I really felt like I was just going to die. I mean, I was just so scared that I was just going to die in the streets right there. Wow.
So these feelings of sort of panicky feelings, is it okay to use that term?
Yeah.
These sort of panicky feelings, about how many times in the last, can I say month? I mean, how long have you had them overall, would you say?
Well, it started a while ago, a couple of months ago, 2-3 months ago maybe. But
and about how many per month are you experiencing?
I don't know. it seems like now it's almost every day.
Almost
like
every day.
A couple of days.
Wow. And about when you have them, about how long does it last before it subsides? Any idea?
Well, I mean, it probably seems like it lasts forever, but it's, after about 10, 15 minutes.
Okay.
That's about all.
Oh, good. Okay, that's good to know. So now an important question, just to help try to figure out what's going on, is that when you have these panic attacks, are they always in like just one event or one thing happening, or can they happen at any time over the course of the last couple months?
I think just any time.
Anytime. So they're not necessarily linked to crossing a bridge or doing any particular activity. They're just happening at just sort of random times.
Yeah, I mean, there's the grocery store is up now. It's just really bad, and I'm really afraid about even going to the grocery store anymore.
Oh, okay. So, so it sounds like you're having these, and they could happen any time, but you're a little afraid now going to the grocery store in case you have one in the grocery store.
Yeah.
And what's the reason you don't want to have it in the grocery store, or what? I mean, what's?
Oh, I know all those checkers. I know those people, and I think I'm just gonna collapse right in the store, and it's gonna be a big scene.
So over the course of the last month or so, have you started restricting places you go out to, like the grocery store, any other places?
I just don't go there anymore. I try to go back again, and it's bad. So I just don't even go there anymore.
So are you spending more than you used to spend before you had these around home? Is that where you stay at home?
Yeah, my husband's really mad because it's hardly I'm leaving the house, and he thinks it's all in my head, but I'm just not going to even go out most of the time.
Oh, okay. Well, so I really appreciate you talking to me. I really, I know these are really painful experiences, but I truly do feel like that they're treatable. There's hope for what you're experiencing.
Really?
Yeah, I've worked with several other people who've had similar experiences, and within, I know this seems like a long time, but within a couple of months, they've really diminished. And there's ways to handle this, assuming that it's not, this isn't caused by a medical condition, and I'm going to go with that. And also, I didn't really ask you if you change your use or you're using any substances that may, like sometimes when people drink too much coffee, you could actually get these kind of experiences. Have you changed any of your patterns with
not really.
substance, drugs, or foods, or?
No, I don't use drugs, and I don't drink alcohol.
Yeah. So assuming that's the case, I do feel really hopeful about the treatment that we could do for this. So with that, I'll be talking to you a little later. Thank you. Cured. So there you go. That's number one. That's the first vignette in the anxiety disorders. And so we're going to end this first videotape, and we'll do another one. And so number two will be coming up. Thank you.